We've been hearing a lot lately about health care in America. We went to Desert Regional Medical Center in Palm Springs and spoke with Dr. Bryan Stone. We asked him to explain why doctor-patient relationships are changing.
The government is in a new position, and they're now paying more attention, as people are aware, to financial issues. And the popular way of doing that now is what they're calling pay for performance. And they've come up with a lot of ways to save money by coming to the physicians, coming to the places where physicians practice, and saying, you help us save money and we'll share it with you. So it used to be you came in with a problem, we said, okay, here's an exam, here's a pill, go home, this is what you need to do, we're finished. And in a 15-minute office visit, we have to accomplish that. Now what they're saying is, we want better from you guys. We want you to perform, we want to track your numbers, we want to make the numbers public, and we're going to share whatever you can save with you and hopefully with your patients. Now we have to do something that's very different, which is called patient engagement. This is going to be the new term that you're going to see over and over. Patient engagement means you have to become part of the team. It's not just about the doctor, it's not about putting up a nice office in a good location. If I tell you how to do something and you go home and do it, then my numbers look good, which is a reflection of you getting better care. If you don't do it, then my numbers start to look bad. So I have to appeal to you. In other words, not only do we say, here's your problem, here's how we're going to treat it, but I have to inspire you to go home and actually take the medication, follow up with the exercise, stop smoking, whatever we're talking about. The problem is basically this, very simply. Somebody comes in, you have diabetes, you have kidney disease, here's what we're going to do, I'll see you in 3 months. Now there's a 3-month block where this patient is, in essence, doing some of what we told them, forgetting some of what we told them, and maybe accomplishing some of what they need, but we have to interact with them now in that 3-month period, and you're going to see a lot of new ideas coming out to do that. Why? Because your performance is my performance. Now you're going to have numbers. You're going to know how many of my patients have their blood pressure in control, how many of them have preserved kidney function, how many of them feel good, how many of them are staying out of the hospital. You're going to have real numbers. They're going to be online. They're going to be true numbers that the public understands. And the government will pay me accordingly. So this is a cultural shift. Doctors are now entering a completely new era of medicine.
Does this change have any negative impact on the patient?
Well, it does have some negative ramifications for the patients. For instance, if I have a patient come into the office and I interact with them and I say, this is what it is that you have and this is how we're going to treat it, and they don't respond, there is no patient engagement, the patient doesn't participate, we may choose not to see that patient in the future. And so it's positive and negative because they may get dropped and have to doctor shop, but on the other hand, they may start to realize that their health is important and have to start actually paying attention.
We asked Dr. Stone what's triggering this change in doctor-patient relationships.
Obamacare is what initiated this. Basically, by 2015, you're going to see a lot of these programs already in place. Our dialysis centers for kidney disease are already under something called a bundle, which means the government basically said, there's escalating cost here, we're going to pay you this much money to take care of these patients, and you do everything you have to within that box. And that's what the government is starting to do. Instead of telling us how to do a better job and paying us less, they're saying, you do a better job and we'll pay you better. And that's a much more positive approach. We have to see in the future if it's going to run. It's jobs, these are jobs that the physicians and the hospitals are not used to doing. So that's why I call it a cultural shift.